This is an important topic. Dr. Wilson and myself, we've been taking care of venous disease for 8 years now. We've been in practice for 9, probably 8 years. And we came to the community to be general surgeons. It's such a common problem that when we came, there was no one around doing varicose veins. I didn't think that I'd be a varicose vein specialist, but when we came here, family doctors called us and said, hey, we've got this patient, she's got painful varicose veins, there's no place to send her, what should we do? And so we'll just send her on over here. Because, you know, both of us had a lot of training in vascular surgery, and I thought we'd get 1 or 2 patients a year, and they just kept coming and coming. So now we're vein specialists. It's about half of what we do is varicose vein treatment. Dr. Wilson's my computer flipper. I'm the talker. This is such a common problem that you can see almost 10% of our population has problems with venous reflux disease. So that's the underlying venous abnormality that leads to varicose veins. So common, in fact, that it's 5 times more common than coronary heart disease. 5 times more common than peripheral artery disease. Twice as common as coronary artery disease. You see commercials on TV for peripheral artery disease, and that's not near as common. We get people all the time in the office that ask, do I have peripheral artery disease? And they've got horrible varicose veins, and they're concerned about their circulation. And really, they do have horrible veins, but they've got great pulses in their ankles. And so know that it's much more common to have good arteries and really bad veins. You can see that in this slide, obviously, I think we probably all could have guessed this, but as you get older, your veins get much worse. 72% of ladies in their 7th decade have problems with chronic venous reflux disease. And less than 10% of people seek treatment every year. So there's a lot of venous disease that goes untreated. Now for us men, the important thing is, look at this. 43% of men aged 60 to 69 also have chronic venous disease. So it's not just pregnancy that causes this, and it's not just being a woman that causes this. Some of us are just lucky.
A couple of things here. As he mentioned, it's a very common problem, and one of the issues that we face is that he had mentioned that only a small percentage of these people seek treatment, and one of the things we're encountering is that they'll go into their family doc or their internist, and they'll mention that they have a problem with their veins, and I can't tell you how many people have had say, well, if it's not bothering you, we don't worry about it, or they just kind of brush it off. It's as if they're not sure what to do about it, and so they just kind of don't deal with it. And so that's one of the reasons why we've actually had to start advertising to the general public to try to make them aware that there is such a problem, that there is an avenue to treat it. And so that's one of the things we've been fighting. But it's common enough that people are out there seeking treatment for it.
That's a great point. And the other important thing, maybe this is the take-home lesson of this whole luncheon. It's not that we expect you to be experts in venous disease. That's our job. But just remember this. It's easy. The treatments are easy. You don't need surgery. There's no downtime. There's no anything. You just come in and smile and chit-chat with us for a little bit, and you get your treatment. It's all just done with needle pokes. And so if you're, unless you're really up to date on venous treatments, which most doctors in the community aren't, you don't know that it's easy to have your veins treated. It used to be to have your veins stripped, it was really hard, and a lot of people just didn't think that it was worth it, and it probably wasn't. But nowadays it's easy. You get to come and spend 45 minutes with Dr. Wilson and have your veins fixed. That sounds pretty good. So there are several lifestyle and inherent factors that are associated with chronic venous insufficiency. We talked about a couple of them. If you're a lady, you're 4 times more likely to have varicose veins. As you get older, they get worse. Family history is a big thing. If your mom and dad had bad veins, you probably are going to get them or have them. Pregnancy, standing occupation. A lot of people who sit all day long also have real painful varicose veins. Overweight, and sometimes even after surgery, you can have traumatic venous problems that result in chronic varicose veins. And then probably a lot of you already know these symptoms, but they're real common. Aching, pain, cramping, burning, itching, heaviness in the legs. You'll see this a lot in swelling. You'll see this a lot in summertime if you watch. I fix veins, so I look at people's legs. But you'll see a lot of people walking around with shorts and their calves will be brown. Or even some people with kind of big calves and their calves get real skinny around the ankle. And those are signs of chronic venous insufficiency. And of course, probably the worst complication is getting venous ulcers around your ankles. And we see a lot of people, interestingly enough, we see a lot of people with these changes that don't have large varicose veins, but they have significant venous reflux disease. So restless legs is also seen a lot in people with chronic venous insufficiency. So this is kind of a real cheap anatomical picture, I guess, of our inside veins that we're talking about. We're not talking about our varicose veins, but inside of our legs we have the deepest veins, which are the femoral and popliteal veins, and then these veins in the calves, but we also have our saphenous veins. There's a lesser saphenous and a greater saphenous vein. Those are, you don't see those in your skin, but that's usually where your problems with varicose veins start, is in those inside vessels. And so this slide tries to demonstrate how veins work. Veins are very different from arteries. They carry blood like arteries, but they don't work like arteries. Arteries are thick-walled. They're not easily compressible. Veins are real thin-walled, and they're easily compressible. And this is how they work, because if you think of what a vein has to do, a vein has to somehow force blood up against gravity out of the legs towards the heart. And it does that by a column of a vein will fill with blood, and then when you're active, just by movement, you're compressing that segment of vein. So the blood has to squirt up because veins have one-way valves that open and close. So when you compress a segment of the vein, the blood can't go down because there's a one-way valve, so the blood can only go up. Kind of like those sticker weeds that you used to get in your socks when you were a kid running through the field, and they can only go one direction. That's the way blood is supposed to work in your vein. It's supposed to go in your vein if the valves work and if you're active. But if the valves don't work, then your vein is kind of like a garden hose that's tilted up. You know, that water wants to just run right out, and that's what happens inside of the vein when the valves fail. And then we say that your vein is incompetent, which means that it has a lot of pressure. And if this is one of those inside veins and you've got a small vein from the skin coming in, there's too much pressure, and so that vein gets that pressure and distends and becomes a varicose vein.
So, as he started to mention there, the problem here is that when those valves don't stop the blood from flowing backwards, every time you stand up, when there's a column of fluid, if you're a diver or anything like that, you know that the deeper you go in fluid, the higher the pressure gets. So when there's no valves checking the flow, you've got this increased pressure down in the veins that's up to 6 or 8 times the normal pressure. That results in the veins stretching out, and that results in pain that you feel. That causes fluid to leak out of the veins into the tissue and cause swelling, and then that's part of what's responsible for the discoloration. They get what's called hemosiderin deposition, or products that are in the blood can go out and actually deposit in the skin and actually tattoo it and make it a permanent abnormality that you see. And so part of that treatment is for people to wear compression stockings. That's one of the things we always have to do, and part of the reason for that is to add external compression to the legs or the veins to kind of compensate for the fact that you don't have a valve that's functioning correctly. And that will also explain some of the symptoms. We had mentioned that restless legs is one of the symptoms of that, and it's because a lot of my patients will tell me when they're active and moving around and not being still, their legs feel better because their muscle contractions are pushing the blood up out of the veins. But when they're sitting for long periods of time, either on a car ride or at work or if they have to stand still at their job where they can't move around very much, then they've learned that by moving around, it helps relieve the pressure, and then at night they'll lay down and try to sleep, and their legs will just be aching, and they can't get comfortable, and they keep moving around, they're jittery, and moving their legs around. So that's kind of this one fact is what explains all the signs and symptoms that people have with chronic venous disease.
So these are problems that we see in patients who have venous reflux disease and those incompetent veins, those incompetent vein valves. So I don't know if you guys can see this, but this is just a picture of really bad varicose veins. Lots of people have bad varicose veins. Then you start to see swelling, and it can be unilateral or bilateral. Also very common. Lots of things cause swelling, not just veins, but veins is a real common cause of swelling. See this calf? You see this a lot at Lagoon in the summer when you walk around. Lots of brown calves. And that's what Dr. Wilson was explaining. That's called hemosiderin staining of the skin. And then finally, this person has an open sore right here. The most common cause of sores in your calves is varicose vein disease, venous reflux disease. So what can you do about it? You can wear a compression hose. You can elevate your legs. You can exercise. You can try to maintain a healthy lifestyle and be at an ideal body weight. These treatments, unfortunately, don't fix broken vein valves. Broken vein valves can only be fixed by either a surgical treatment or what we're going to talk to you about today. But these help control the symptoms of that reflux disease or those incompetent veins. Okay, so then what can you do? Well, I'm sure all of you know someone who's had vein stripping. So it used to be, and not long ago, and in fact some doctors still do this, they take people to the OR, you get put to sleep. That saphenous vein, the saphenous vein kind of runs where the inside seam of your pants is. You know, you take a person's surgery and you can remove that saphenous vein. It really hurts to have your saphenous vein stripped out. And if you do it, I hope you really want to have it done because you're going to be in pain for about 3 weeks laying on the couch. Ligation just means tying off the vein. That really doesn't work. But vein stripping really helps if you have an incompetent saphenous vein. The good news is that you don't have to go through that. So what we've been doing for 8 years now for these incompetent veins that lead to varicose veins is we've been doing a treatment called endovenous ablation. And that just means that we poke into the vein. It sounds much worse than it really is, trust me. But we numb your skin and we poke into the vein and we slide this catheter into the vein. This is one of the catheters that we use. So it sounds horrible, and it looks horrible, I know. But it's kind of like getting an IV in your vein, and then the catheter slides up. You can't feel the catheter go up your leg. And then we put numbing medicine around the vein, and then the catheter cauterizes the vein, and it seals it shut. That's as good as having the vein removed without all the pain and the trauma and all that. People come in to the office to have a treatment. They hopefully are smiling the whole time. Maybe they wince a little bit occasionally. Chit-chat with us for about 45 minutes. Takes about 45 minutes, and then they leave. There's no restrictions. You just have to wear your compression hose. What do you want to...
The other big advantage to this, and unfortunately some of the other docs in the community don't take advantage of it, but this can all be done under local anesthesia. You come in, as you said, we numb up a little spot on the skin, and basically we're starting a big IV, but once we're done, we wrap your leg up and you walk right out and you can go back to work if you wanted to. But you don't have the risk of anesthesia that goes along with that, as well as the cost of the anesthesia and the anesthesiologist. Plus, if you're in the operating room, that adds thousands of dollars to these treatments. And it's all done outpatient, and we're sitting there chit-chatting like he says, and it's really interesting. I can always tell when someone comes in, and usually they have multiple veins that need to be treated, and I guess that if there's one downside is there could be multiple treatments involved, but the first time they're coming in, they're always a little nervous, they're kind of sitting like this, and then once they've come back for their second treatment, they're very relaxed because once they've been through it, they know that it's a relatively easy procedure, and they do really, really well with it.
But people ask us all the time, when we're seeing, people for the first time, is it really worth it for me? I'm 80 years old, or I'm 85. Is it really worth it? And yeah, when you see what the treatments are like, of course it is. If you can just come in and get poked a few times by the doctor and walk away without all of your vein pain, it's totally worth it. It really doesn't matter how old you are or what your problems are, your other health care problems, because this is a simple thing to go through. Before we do this treatment, we have to know for sure that your veins are incompetent, like we talked about. And the way we prove that is with an ultrasound. So every person that we see that we think needs it, we'll schedule an ultrasound with the technician that comes to our office on Mondays, and she'll scan the leg. The ultrasound machine can see the veins inside of your leg, and she can tell if the veins look dilated and abnormal. But most importantly, the ultrasound machine can see the direction of blood flow. So if our sonographer puts her probe right over your saphenous vein and she sees blood going down, well, now you guys all know that means your vein is incompetent and your one-way valves aren't holding the blood. So if we get a report that says your saphenous vein is incompetent, then you're a candidate to have this intravenous ablation. So I think we've already said all this stuff, but this is just, you want to play the video for me?
Yeah, let's do that.
So this is kind of a video of what happens. It looks worse than it is, trust me.
How big is that needle at the end?
So the catheter is, see how big it is?
Oh, I thought they might be, at the very end.
So that slides up to your vein, and that looks really bad, but unless your vein has a strange kinking or something, you'll never feel the catheter go up your vein. And then you put numbing medicine around it and you can't feel a thing. Obviously, without numbing medicine, you wouldn't tolerate this for a second, but with the numbing medicine, it's painless.
Looks like those the knee up.
What?
Yeah, we start usually down around the knee and then run the catheter up to about an inch away from where it joins the deep vein. We have to stay away from the deep vein because that's one of the risks of injuring the deep vein. But one of the advantages of this technique is that this catheter has a thermocouple in it, so it monitors the temperature at the tip. The important thing is to hold a certain temperature for a certain length of time. The machine that we use to generate that heat monitors that temperature, and it decreases the power accordingly to maintain that temperature, so that it's a very controlled, very regulated process where the thermal injury generally only affects the vein itself and doesn't spread to any of the tissue outside. There's other modalities out there, such as laser therapy, where you turn the switch on and it just goes, and you have to control it with how quickly you pull the catheter out. But we actually did it for a year or so, and patients would come back and they'd have significantly more pain, swelling, bruising around there. So this radio frequency has been very nice in that it's just enough to do the job, but not a lot of extra tissue damage around it.
Yep. That year that we had the laser, it worked great for a year, but I had to give Lortab to everyone. I don't know, did you do that? And with this, I probably give one person a year Lortab, maybe that, if that. So it's really nice. It's kind of like Tylenol discomfort afterwards. So, and then what do you do for the varicose veins? Well, once we fix the inside vein, the vein you can't see, you still want to get rid of your varicose veins, right? So they go down quite a bit. We had a picture of that. Here, put this. They go down quite a bit because remember, all the pressure that's dilating those varicose veins comes from that inside vein that was bad. And we fixed that with the intravenous ablation. But then if we want to do any further treatments to get rid of your varicose veins, you've got two choices. You can have me, or Dr. Wilson, pull them out of your leg through little incisions. That's called thrombectomy. I really hate doing that. And patients don't really like it either. Or we can just put some medicine in the vein that will scar the vein shut. Probably most people have heard about injecting saline. It's the same idea, it's just we use a medicine now that's a lot safer and a lot more effective and hurts a lot less. But a saline injection, in this picture they're showing you that the catheter treatment took a person from this to this. I hope you can see that. But usually, you know, if there's residual varicose veins, we'll just inject them and that'll take care of it.
Yeah. And one of the things I try to emphasize to patients is that when they come in for treatment of their veins, the varicose veins are kind of like the tip of the iceberg, the symptoms that you're seeing. I use the analogy of relating it to the varicose veins are as if you went down into your basement and there was a flood in the basement. And I always tell people you wouldn't just go in and just start replacing the carpet down there. You'd go find where the water is leaking from. And so the first thing we do is go in and treat the vein that has the incompetence that feeds those valves. However, just taking the cause away doesn't undo all the damage that's been done over years. So sometimes the veins will shrink down nicely like this. Oftentimes they don't, and then we're looking at other modalities. The good thing is that most people, once they get that pressure off and their pain is relieved, most people aren't as concerned about what they look like. They just want to have that achiness and that throbbing and restless pain that they get every night to go away. Doing the endovenous ablation we can't undo all the years of damage that's been done, but oftentimes we can go in and improve things significantly.
So those are the two main treatments for varicose veins. First, the catheter, the endovenous ablation, and second, sclerotherapy. Those are by far the two most common things that we do. You don't need to have surgery, you don't need to have incisions, except for very rare exceptions. And it's simple.
Is it painful? How about
It's I have to poke you with a needle, and I have to put numbing medicine in you, so that burns a little bit, but it's not a lot worse than that. The thing that makes it the most painful is really patient's anxiety. Sometimes people come in real worried.
Well, I've had one of my legs done, and I can tell you truthfully, the very worst part is the doctor's bad jokes.
You must have seen Dr. Wilson.
Me.
The only real discomfort, they look at me, but the part I hated the most was wearing compression hose
Yeah.
after, aggravation. But it was way worth it.
Yeah.
Not painful at all.
Let me answer the most common question that I get from people. What's your leg going to do now that you get rid of that bad vein? How's the blood going to get up? And the answer is this. That bad vein was not moving blood up out of your leg. That's why it's a bad vein. It's an incompetent vein, and in fact, it's working against all of your good veins. So when we get rid of it, you're better. Does that make sense? It's like addition by subtraction. You get rid of the vein that's incompetent, that's letting blood stagnate in your leg, and it helps.
Yeah, because the problem isn't that you don't have a vein to take the blood back. It's that the vein that we're closing is actually putting more blood down in the leg. The veins are all interconnected. They're kind of like roads around here. If Antelope's getting work done, you got to go around to 193 or whatever. But there's other channels, and so when we close off that incompetent vein, what we're doing is just eliminating more blood that has to go back through those other veins that usually have competent valves. And so what that does is essentially there's less blood pooling in the leg, which makes it less heavy, less achy, less throbbing, and as you said, just it improves the circulation. It doesn't hurt it at all. But yeah, everyone gets real big and wide-eyed when we tell we're going to be closing off a major vein.
A majorly bad vein.
Get nervous about that. So, but it doesn't hurt. So, question?
I have a question or a couple. Does Medicare pay for this, and also how long do you have to wear the compression hose?
Yes, Medicare does cover varicose veins, as do most insurance companies. There's a couple that are a little more stringent on their criteria. The role of stockings is several-fold. One, we always start patients in it when we initially see them in the office for two reasons. One, to see if it helps her symptoms. That's the main one. And then 2, insurance companies require usually a period of anywhere from 6 weeks to 6 months of compression stocking therapy before they would authorize any additional treatment. And then after the treatment, we like you to wear the stockings for the first 72 hours around the clock, and then after that 3rd day, just wear them during the day for about 2 to 3 weeks is all. And then the idea is to get you out of the stockings so you don't have to wear them again. That's, depending on what we find on the ultrasound, that's not always possible. One thing we didn't talk about initially was the anatomy of the venous system in the leg. We look at kind of 2 sets of veins in the legs, deep and superficial veins. Superficial veins are the ones that are right under the skin that you can see. They're above the muscle layer. Deep ones are underneath the muscle layers. And the distinction is that we can't, if you have incompetency of the deep veins, that's something that we can't go in and fix with the ablation or the surgical procedure. We can take care of the superficial veins. But there are some patients who come in and they have not only incompetence of their saphenous veins that we can treat, but also of the deep, the femoral veins that we can't. Sometimes those patients will require lifelong compression therapy.
But unless you've got skin discoloration or ulcers or a lot of swelling, you don't most people don't need to wear compression hose all the time. It's good for some people, not for everyone. Any other questions?
Have you ever had incompetent veins with blood clots in legs? Is there any correlation to that?
Yeah, there's a big correlation. A blood clot, blood clots are famous for causing incompetent veins. So if you get a blood clot, you'll have resistance in that vein, which can stretch the vein. If the vein is stretched enough, think of those valve leaflets. If you pull those valve leaflets apart, they're not going to work anymore because they're not going to come together. So yeah, blood clots will cause a lot of incompetence.
And conversely, incompetence can cause people to develop blood clots, because what happens is you have the incompetence, the varicose veins develop. So instead of having a real narrowed, straight vein, you have this large thing that wiggles back and forth, and the blood doesn't flow through that as fast. When blood slows down, it has a higher tendency to form a clot. So we'll see a lot of people who come in, their presenting complaint is that their varicose veins have started to clot off, and they get red and hot and painful and swollen, and people think they have an infection, and that's one of the symptoms of having advanced varicose veins, is you start to develop blood clots in those. It does also put you at an increased risk of having a clot in the deep veins, because those clot in a vein can propagate. It grows as it goes along, and it can protrude into the deep vein and actually start causing problems there. So.
Would certain drugs like warfarin have an effect on this procedure?
Well, Coumadin or warfarin is a blood thinner. When we first started doing this 8 years ago, that was still pretty early, and not very many people were doing this. We had people stop their Coumadin, but soon we realized, I don't know if you do, soon we realized that we just don't have problems with bleeding. If you are on Coumadin and you need a treatment, and I poke you with some needles, you might get a little bit larger bruise than most people, but you won't have problems with bleeding. Whereas one thing we worry about is blood clots. That's one of the risks of this procedure. Very rare. I've done well over 1,000 of these, and I've had only 3 patients get deep vein blood clots. All 3 of those patients had clotting abnormality, where they'd had several blood clots before in their lives. And so I never tell people to stop their blood thinners. In fact, sometimes I put people on additional blood thinners. So yeah, no, it's just needle poke. So
Yeah, it's completely safe.
Thank you.
What causes leg cramps, especially early in the morning?
well, I don't know. I mean,
If we had the answer for that, we probably wouldn't be here.
you don't eat enough bananas. I don't know. Varicose veins, that is a common symptoms with varicose veins and venous insufficiency, but there are so many things that can cause leg cramps that I don't know. It's like swelling. Some people come to us and they have perfectly good veins and they're swollen. So there's a lot of things, that can lead to that, but Certainly veins can cause your cramps, but I can't tell, if you come to me and you say, I've got these varicose veins and I've got horrible cramps, Dr. Jensen, can you please fix my cramps by taking care of my veins? And I'll say, no, I can take care of your veins and maybe your cramps will get better. Sometimes I can tell you for sure that I'm going to cure your problems, and sometimes I can just say maybe. Anything else?
With this procedure in the veins, does it help with involuntary movements with restless leg syndrome?
It can. It certainly can, because like I said, it takes off that achy discomfort that you feel that causes you to kind of wiggle around a lot. I had one patient I remember early who, really young gal, one of her big complaints was that she had trouble sleeping at night, and because of the kind of the restlessness and just discomfort, and she would just never sleep well. And she came back after one of her procedures and told me that her husband was saying that he couldn't wake her up now. She was sleeping so well, and those symptoms had completely vanished. There can be other causes of restless leg syndrome, and so it doesn't automatically fix everything, but if it's due to your pain from your varicose veins, then yes, it will. Yes. Oh.
Go ahead.
Like right now, the outside of this left leg is just hot, burning, and down into my foot and numb, and I don't see varicose veins. I see little hair veins now. Is that what part of this treatment?
Well, so you
Or
brought
who do
up
I see about
you
it?
brought up a symptom that it's one of these symptoms, just like leg cramps and restless legs. Numbness can be associated with this problem, with venous problem, but you could also have a neuropathy or a pinched disc or all kinds of stuff that can cause your numbness. Sometimes people come to me with these symptoms, and I don't see obvious varicose veins, and I just say, I don't know, let's get an ultrasound and see what's wrong with your legs. And occasionally the ultrasound is totally normal, and then I say it's not your veins, you're going to have to go talk to your family doctor or whatever. But sometimes I'm surprised, and it is your veins. You know, the ultrasound will come back grossly abnormal, and then that gives me hope that our treatments will fix your problem. But yeah, some of these symptoms can also be attributed to other things.
Like, main appointment and seeing you can tell me the problem with this, if it's not varicose vein.
I can tell you if you have venous disease or not with an ultrasound. So the benefit of that is just checking off one of the possibilities, I guess, of your discomfort. But yeah, numbness can be associated with bad veins. Go ahead.
Well, I feel very grateful that I only have the problem in one leg. Is that normal, or am I going to develop it the other leg eventually? And why not both at the same time? It just seems like the same problem would happen to both legs.
Yes, it can be normal, and you can get it in the other leg.
Okay, so down the road.
Yeah.
But you know, probably the majority of our patients do have it in both legs, but you know, it's not unheard of to have it in one leg, and that I don't think that necessarily portends an increased risk for developing it in the other leg. You know, it's just something went wrong in the development, the valve didn't form right or something like that, and that can happen in one spot or both spots or either. So, not uncommon to have single side. Let's see, there was some in the back there that we didn't get to. Way in the back.
If you have large superficial veins externally on the side of you, in the front of your shin, or in your cross, and you both of them, is there risk of tearing that vein open? Is that a reasonable worry about?
Yes, it is. The problem with venous insufficiency is that, as you said, it markedly increases the pressure in the veins. Normally, when you cut your skin and a vein gets cut, it just kind of drips out. When you cut open a vein in your foot or ankle that has insufficiency leading to it, it'll shoot across the room and hit the wall. and it's even worse than an artery, because an artery will just go psh, psh, and spurt occasionally. Those veins, it just pours out of there. In fact, one of the reasons we don't like doing those phlebectomies or removing the veins in the office is because they bleed like crazy. I mean, it's impressive blood flow, and we see a lot of blood loss, and it can really pour out of there. I've had a couple of patients who, most commonly, they'll get a little scab on a vein around their ankle, and they come out of the shower, and the scab softens up, and they brush it off, and next thing they know, they think they're in a Friday the 13th horror movie because it is a mess, and blood goes flying out. I had another guy who he was asleep, and his dog started barking. He wakes up, and he's like, "What are you barking about?" And then he felt something wet and warm. He had started bleeding in his bed. He was just laying there in a pool of blood. If his dog hadn't woken up, it would have gone on for a while. And I'm sure he would have noticed eventually, but he could have gotten to the point where he needed a transfusion. But yeah, it doesn't happen very often, but when it does, it's impressive bleeding.
Best thing for that is put pressure on it and call us.
Yeah.
And pressure really will solve, just holding pressure on it will, eventually your blood will clot. But that vein should be sclerosed, or in other words, should be injected.
You want to lie down, put your leg up in the air, take the pressure off it.
Yeah.
If you see the large, like clusters of veins that are kind of gnarled all around themselves, like the cauliflower or
Yeah.
something, is that indicative of clots or just the vein that's gone crazy?
It means that you have too much pressure in that in that system of veins. So you need, or whoever, needs to have an ultrasound. We need to diagnose what's behind that. Something that you don't see is causing what you see. So we need to get an ultrasound and figure it out. Yeah, we see a lot of brains. They look like brains across thighs and stuff. The cool thing is getting rid of those. It's amazing when they're gone.
And the other great thing about this, and I was a little skeptical when we started, because as we know, the historical procedures were often very painful and had up to a 30 to 40% long-term recurrence rate. But we'll have patients come back in a week and just go on about how much better their legs feel. And I had one gal who, she couldn't go to Lagoon with her kids because she couldn't walk for more than 15 minutes without suffering, and now she go out and walk for hours and do fine. And then the one gal that she could sleep now, and patients who've even got up off the table and say that their legs feel better. I mean, it's just amazing the significant improvement in pain that we can get with this. It's just a really rewarding feeling, especially for being so minimally invasive. Just a little teeny scar in the leg, and things feel a lot better.
Dr. Wilson and I are surgeons, so we do a lot of different operations on people. And I can honestly say, and he'll agree with this, there is nothing that we do that's as minimally invasive, that has as little risk of hurting a person, that creates such a good benefit. Nothing. This is the easiest part of our practice, because we see people, and usually it's more smiles than frowns, and there just aren't problems afterwards. I mean, there's a few problems, but not usually. I mean, it's really great. Was someone going to ask a question?
Is there a difference between varicose veins and the kind we're talking about?
Okay, so what we were talking about, this venous reflux disease, we're talking about incompetent vein valves. And mostly we're talking about those saphenous veins, those perforated veins that are inside, maybe an inch deep to your skin. But that is what causes your varicose veins. So it's all part of the same problem. But you see your varicose veins, you don't see your incompetent saphenous vein that's caused your varicose vein.
When we're talking about varicose veins and veins disease, we're primarily talking about the legs. Can you have this type of vein elsewhere, like in your abdomen or through your groin, if you also causes some pain?
Yes, you can. It's much more common in the legs, just because it's a more dependent area and there's more pressure in your leg veins. We do see, not a lot of times do ladies like to tell me about veins in their private areas that are bulging, but occasionally we'll get ladies, but even more commonly, girls who've been through pregnancies and then have really painful, we call them vulvar varicosities, but varicose veins in your privates that we end up treating. Yes, can happen anywhere. Is that it?
Just let me conclude by following up. The lady over here had asked, who do I see about this? And we generally recommend that you start with your primary care doctor, especially if it's for, a kind of a more vague symptom like swelling or numbness. If you have, florid varicose veins, and you can obviously see what's going on, then it'd be appropriate to just come directly to us and we can start the evaluation. But work with your family doc, and if you think you have the varicose veins, but they, as I said, some of them just kind of say, well, yeah, don't worry about that, it's not going to hurt you. But if you do want to get an evaluation, you can just call us directly, and we can initiate that. So, and thank you all for your time.
We're just right across the hall. Thank you. If anyone has any further questions or wants to come up and look at, we have an ultrasound machine here, we can kind of look at some veins, or you can look at the catheters and things like that we have up here if you're interested in that.